Mombasa and Nairobi city counties have had the highest infection rate of COVID-19. And we've been able to look at this and define that Mombasa has an attack rate of about 107, whereas Nairobi has about an attack rate of 55. And these statistics are important because it tells us that the risk of transmission, the risk of you getting COVID-19 is higher in Mombasa compared to Nairobi counties. And again, we are working to ensure that we are actually able to define risk per county as we continue going forward. And therefore, from all these statistics, it becomes less tenable to isolate confirmed COVID-19 patients in hospital-based treatment. And therefore, as we roll out the home-based care protocol, it's important to know that we are focusing on our high-burden counties, particularly those that have a high attack rate. And as highlighted, that is Mombasa and Nairobi. We are working with community health workers and volunteers to ensure that we educate our households and our caregivers in this program. And the training, as I said, is targeted particularly in the high-risk counties, and this is where we will start the rollout of the home-based care protocol. In terms of training, some of you might wonder, what exactly is this training focused on? And the idea is that we're able to go to households, we're able to get in touch with the family members, take them through what it means to be eligible for home-based care. So not every single Kenyan is eligible for home-based care. There's actually a criteria that determines who would be able to be enrolled into a home-based care program. We then review the feasibility. How are you able to actually ensure that the home-based care program is working in your household? And then what are the procedures that need to be in place? How do we monitor? How shall the healthcare worker be able to engage with you to ensure that we're looking after you and your family and ensuring that you're adhering to the home-based care protocols? It is important to know that our training goes further to empower individuals and households with basic knowledge, skills, and competencies to be able to enable them to function as caregivers of COVID-19 patients. Now, onto our COVID-19 situation. In terms of statistics today, we tested 4,859 samples, of which 254 people tested positive for the virus. Therefore, this brings to total our country caseload to 5,206. The total number of tests conducted thus far cumulatively from the beginning is 151,396,000 tests. All the positive cases are Kenyans, and we have 186 of them as male and 68 as female. And it's important to note the trend continues. Our male patients, our Kenyans, our fathers and brothers continue to be the ones who are highly afflicted with COVID-19. And with regard to the 254 positive cases, in terms of county distribution, we have Nairobi having 127, Mombasa having 36, Migori 29, Kajiado 22, Kiambu 12, Busia 9, Uasin Gishu 5, Murang'a 3, Machakos and Kilifi have registered 2 cases, and we have 1 case from Nakuru, Siaya, Taita Taveta, Garissa, Isiolo, Kakamega, and Kisii, all having 1 case. We do also have distribution in terms of sub-county, and I'll highlight some of the key ones. I won't go through to all of them. In Nairobi, from the 127 cases, we now have 32 cases from Westlands. In terms of Dagoretti North, we have 18. Lang'ata has 16. Kamukunji has 14. And Embakasi East has 12. In terms of Mombasa, we have 36 cases from Mombasa, of which 11 are from Mvita. Jomvu has 8, Kisauni and Likoni both have 5. And in Migori, the area that has the most caseload would be from Suna East. In Kiambu, of the 12 cases that we've mentioned, most 4 each are from Thika and Kiambu town. In Busia, in terms of the 9 cases, we have 7 from Teso South. In Uasin Gishu, the 5 cases, we have 3 from Ainabakoi, and Tabo and Keses have 1 case each. In Machakos, we have a case in Athi River and 1 in Matungulu. And in Kilifi, we have 2 cases in Rabai and 1 in Kilifi South. We will provide you with this disaggregated case list. What we are noticing is that now the disease is really spreading across all the different wards within the country in terms of the counties that are afflicted. Yesterday, there was a question with regards to the testing in the country in terms of the numbers tested positive, also the cumulative number tested, and we've also provided this information for you today. Again, I won't go through it all, but if we can touch on a few counties. With regards to Busia, in terms of the samples that were collected in the last 24 hours, from Busia, we have about 9 cases that tested positive, out of a total of 353. So what this means is that in the last 24 hours, we have a positivity rate in Busia of 3%. I'm going to try and pick out perhaps what we have in Nairobi. In Nairobi, we have 127 cases, of which in terms of samples collected, we did 2,484 in Nairobi County. Again, giving us 5% positivity rates in Nairobi. And it is important, and I'm sure we'll ask the DG to expand on what it means in terms of this positivity rate. We have it differing. We have counties such as Kajiado in the last 24 hours having a positivity rate of 15%. I'm sure the question will be, what does that mean for Kajiado? We have counties like Kakamega with 1 positive case out of 5 samples collected, so 20% positivity. We shall highlight to you perhaps during the question and answer session what this means. Ideally, it is a statistic that is useful for us. However, it needs to also be interpreted with caution and in view of looking at other statistical figures, but I'm sure the DG will talk on that. On a positive note, we have discharged 41 patients from various hospitals, bringing the tally of recoveries to 1,823. And our gratitude goes to the healthcare workers for the good work. However, sadly, we've lost 2 more patients to the disease, bringing a total number of those who succumbed to 130. And our thoughts and prayers are with the families and friends of those who have departed. And as we conclude, we would like to thank our healthcare workers, and in particular our community health volunteers, who are supervising the home-based isolation care program in conjunction with experts in the Ministry of Health, and we thank them for their commitment and dedication. And the success of this program really is pegged on them and the adherence of these protocols. And as highlighted, the protocols are available at the Ministry of Health's website. You Google www.health.gov.ke, you'll be able to see these protocols there, articulating all the measures that need to be taken, how you're able to actually enroll into the program, what the eligibility criteria is, how monitoring and supervision is conducted within the program, how discharge looks like, and what follow-up would also look like upon discharge.
There was another question about vaccine. Yes, Kenya is a member of the global health arena and will play our role appropriately as the vaccine studies continue. Of course, development of vaccines is a process, it's not an event. You need a bit of time, you require lots of resources, and we have credible institutions, including our KEMRI, which will be part and parcel of this process at a due time when the right procedures and protocols have been addressed.